Look, nobody ever wants to imagine their pet in an emergency. But being ready, well, that can literally be a lifesaver. So in this explainer, we're going to walk through some really clear, simple steps for the most common pet emergencies, so you know exactly what to do when every single second counts.
It's a terrifying question, isn't it? That split second when you realize something is seriously wrong. Your heart just drops, your mind starts racing, and what you do in that next moment, it matters more than you can possibly imagine. And that's really the heart of it all. Panic is your worst enemy in a situation like this. It just clouds your judgment. But being prepared, that's your greatest ally. Knowing these first aid steps can be the thing that makes all the difference. So let's dive in and get you ready.
All right, first up, let's talk about the dangers that can be lurking just outside your door. You know, your backyard or your favorite hiking spot can hide some pretty serious threats. And the first couple we're going to cover are incredibly time-sensitive.
Okay, a snake bite is a true no messing around emergency. The single most important thing you can do is get your pet to a vet immediately. Your job is not to be a hero here. Do not try to catch or kill the snake. I repeat, do not. If you can do it safely, maybe try to remember its color or pattern, but your absolute #1 priority is getting your pet professional help fast.
So how do you know if it's a snake bite? Well, the symptoms can hit hard and fast: sudden swelling, vomiting, or even a total collapse. But here's a really crucial point. Don't waste precious time looking for fang marks. Seriously, they're often tiny or completely hidden by fur and swelling. If you see these signs after your pet's been outside, you have to assume it's a snake bite and act right away.
So here's your action plan, and listen up, because every single step is designed to do one thing: slow the venom spread through the body. Keeping your pet still is absolutely paramount. Why? Because movement pumps blood and that venom around faster. That's why you have to carry them. Don't let them walk a single step. A pressure bandage can help for sure, but nothing, and I mean nothing, is more important than speed. Get to that vet now.
All right, our next outdoor threat is way smaller, but trust me, it's just as deadly: the paralysis tick. Now, this isn't your average tick. It's common along Australia's east coast, and it ejects this powerful neurotoxin that causes a slow, creeping paralysis, one that can eventually stop the very muscles they need to breathe.
And the scary part is, the early signs can be incredibly subtle. We're talking about a slight change in their meow, or maybe their back legs just seem a little wobbly, a small cough. It's so easy to just brush these things off, but you can't. Even one of these symptoms, especially during tick season, is a massive red flag. You need to call your vet.
Now, this is something you absolutely need to understand. Just pulling the tick out is not the end of the emergency, not even close. As this quote says, a pet can get much sicker or even die up to 72 hours later because that toxin is already working its way through their system. Removing the tick is just step one. Getting to the vet is the essential next step.
So here's the plan. Get that tick out, keep your pet calm, and call your vet. But pay very close attention to step 3. Do not offer food or water. I'm going to say that again. No food, no water. The toxin can paralyze their throat muscles, which creates a huge risk of choking or breathing liquid into their lungs. Only a vet can tell you when it's safe for them to eat or drink again.
Okay, we've covered the great outdoors. Let's head inside now. Our home should be a safe haven, right? But it often contains poisons that are every bit as dangerous as anything lurking outside. So this table lays out 3 really common household poisons. You've got rat bait, which is an anticoagulant. That's a fancy word meaning it stops blood from clotting, leading to internal bleeding. Then there's snail bait, a nasty neurotoxin that causes seizures. And of course, chocolate, which can totally overstimulate their heart and nervous system. But look at that last column. What's the one thing they all have in common? The crucial first step is always go to the vet immediately. Don't wait and see.
You know, so many people think, oh, a little piece of chocolate won't hurt. But it's just not true. The problem is a chemical called theobromine. We humans can process it just fine, but dogs can't. It builds up in their system to toxic levels, and it's basically like a massive caffeine overdose that can completely overwhelm their heart and nervous system.
All right, moving on from poisons, let's talk about physical injuries. Accidents can happen anywhere, and knowing how to handle a wound in those first critical minutes is such a vital skill for any pet owner.
So the key tool in your first aid kit is the pressure bandage. Its job is really simple but absolutely critical. You apply enough direct force to the wound to physically squeeze the bleeding blood vessels shut. That pressure is what allows a clot to form and stop the bleeding. And here's exactly how you do it. You place a clean pad over the wound,
Apply firm, direct pressure, and just hold it. Now listen very carefully to this next part. If the blood soaks through the pad, your first instinct is going to be to rip it off and put on a fresh one. Don't do it. If you do that, you'll just pull off the clot that's starting to form and the bleeding will start all over again. Just add more layers right on top.
This is maybe one of the most important rules in all of first aid. If your pet is impaled on something, a stick, a piece of glass, whatever it is, leave it in. That object might be acting like a plug, stopping a catastrophic bleed. Pulling it out could be fatal. Your job is just to stabilize it as best you can and get to the vet, where they have the tools and expertise to remove it safely.
So, we've covered how to react in a bunch of specific emergencies. Now, let's wrap this up by talking about how to build a plan. Because the goal isn't just to react, it's to be truly prepared.
You see, you can't really know what's abnormal if you don't know what's normal for your pet. This chart gives you the general ranges, but I want you to take some time when your pet is just chilling out and learn their specific resting heart rate and breathing rate. Just feeling their pulse, counting their breaths, it's an incredible tool for spotting trouble early on. And this right here, this is the foundation of your emergency plan. It's simple stuff, but it's essential. Have your vet's number and the address of the nearest 24/7 clinic saved in your phone. Post it on your fridge. Know the route before you're in a panic trying to find it. And finally, keep a well-stocked first aid kit and a pet carrier, somewhere you can grab them in a heartbeat and just go.
So that really is the final question you need to ask yourself. Right now, at this very moment, could you grab what you need and be out the door in less than a minute? If the answer is, maybe not, then now is the perfect time to change that.
And ultimately, that's what this is all about. It's not about memorizing every single detail perfectly. It's about shifting your mindset from one of panic to one of preparedness. Because when you're prepared, you give your best friend the absolute best possible chance.